Between 5 p.m. yesterday evening and 5 p.m. this evening, Gujarat has recorded the lowest deaths due to COVID in the last 7 days. So the deaths today, which have COVID as the primary cause of death, account for about 8 cases of unfortunate deaths. There are 15 unfortunate deaths that happened in individuals who had a very serious underlying condition or a comorbid condition and also contracted the infection of COVID 2019. Today there have been, in this 24 hours till 5 p.m. today, we've had 394 new cases of COVID 2019. In the same period, as many as 219 people have taken the treatment successfully and got discharged. We also want to share that the recovery rate, if we compare the recovery rate that we found, this today's recovery rate with what it was 15 days ago, there has been a 457% increase in the recovery rate. There's also another good piece of news today. We had, at the request of our Honorable Chief Minister, Shri Vijay Rupani Sahab, he had requested the Union Home Minister, Shri Amit Bhai Shah, to send a special team of the top experts who can advise and see what is it that can be done further in the civil hospital, the COVID hospital in Ahmedabad. So it was absolutely immediately the Union Home Minister, Honorable Amit Shah Sahab, responded by sending a top team of the foremost or the most prestigious institute of the country, All India Institute of Medical Sciences. The director, Dr. Randeep Guleria, along with Dr. Manish Sureja, were here. They interacted from 9 this morning till this evening with different stakeholders ranging from all the doctors who are treating the patients there. They actually saw all the detailed discussions, the case prognosis papers. They interacted with the residents, with the private doctors who were also coming to the hospital, interacting. They took a complete visit, a virtual visit of the entire facility, saw the protocols, infrastructure, the progression, etc. And they were completely satisfied and expressed their happiness at the manner in which all the work at the hospital is happening. They also specially took note of the fact that we are also carrying out various new innovations, which, for example, the awake proning or conscious proning, which is being followed in all the places. They also noted that we are also giving the anticoagulants, several trials which have been started, research processes, and several other new techniques which are being followed. These were all noted by them, and they appreciated the excellent work being done by an entire team tirelessly and with so much of commitment. In fact, there are 2 points, however, that they said we ought to reach out to all of you and request that the citizens at large immediately, if there is high fever and if there is breathlessness, without any delay, that they report to the hospitals immediately. So they said that the 2 major reasons for this mortality, higher mortality that they saw, was that people are reporting very late, and by the time they reported the hospital, there is most of their condition is deteriorated, and there's not much of a possibility of really reviving them and saving them. Similarly, they also mentioned that most of these are those who are having severe comorbidities or multiple comorbidities. So this was the response of the team from the top class All India team that had come today, 2 of them. They were specially flown in here and have returned back this evening. They also had a detailed meeting with our Honorable Chief Minister and the Honorable Deputy Chief Minister and all the senior officers of the state. We have another heartwarming success story for all of you today. Following the Ayush guidelines for treatment in the COVID Care Center at Ahmedabad, our Ayush team has been actually working on as many as 985 patients who are tested positive for COVID, and it was found that for 213 of them who were given this treatment, all of 203 of them have actually tested negative 2 consecutive times. That means they can be discharged in a very short period of having taken this for 7 days. And what was the treatment that they took? They were given Samsham Vati, 2 tablets twice a day for 7 days. They were also given Dashamula Kavat, Pathyadi Kavat, 40 ml, Trikut Churna, 2 grams. They were also given a special Ayush 64 tablet once in the morning and once in the night, twice a day. And Yashti Madhu Ghanavati 1 tablet every 2 hours. This was to be actually chewed, and this was to be taken 6 times in a day. So what is very, very heartening to note is that out of these 213 patients who were positive, who underwent this treatment, 203 of them, after undergoing this, have tested negative 2 times consecutively and have got discharged. There are 11 patients, however, who did not complete this course for 7 days, and they still have mild symptoms, and the treatment would be further augmented, and they've been referred to the civil hospital. But this is a very positive and a very interesting and a very heartening breakthrough that we've had today. So we again request all of you to work on boosting your immunity. Let's not panic. Let's learn to live with COVID without getting too worried. Let's be cheerful, and let's do everything that we can to boost our immunity and be calm. Thank you.